Welcome everyone. MoreGoodDays acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past, present and emerging, and we extend that respect to all Aboriginal and Torres Strait Islander peoples today. Welcome everyone, I'm Sonja. I'm one of the support coaches here at MoreGoodDays. I was diagnosed with fibromyalgia in 2012. I did the MoreGoodDays pain management program in 2022, and then I joined the MoreGoodDays team as a support coach in January last year. Before I go any further, I'd just like to remind everyone the session is recorded, that your presence today indicates that you accept the rules that were invitation, which I'll just remind you of. The session is recorded, including the presenter and any speakers. No hate speech of any type will be tolerated. You will be removed. Be respectful of the speakers and everyone else present. Please keep your microphone muted. Ask any questions in the chat. You do have the option to tick an anonymous posting of that chat so that your name won't be attached to that question, and I'll read it out and ask Angela to answer it. She will only be able to answer some very specific questions because we did have an awful lot submitted in advance. That's a little bit more about MoreGoodDays. We're a pain management company. We have started off with a program specifically designed for people with fibromyalgia. We have some more programs in production for other pain conditions, but we have everything that we do is research backed. We combine neuroscience and psychology-based techniques to create online programs that help you learn tools and strategies to help better manage pain and other symptoms. We know that the management of chronic pain, particularly like fibromyalgia, takes a multidisciplinary approach. So we aim to cover a wide variety of topics. And one thing we get a lot of questions about is hormonal changes and the effect that this can have on pain and other symptoms associated with fibromyalgia. We get questions from menstrual cycles, menopause, pregnancy, changes in testosterone levels. We know that there's a lot of people really interested in the possible connections between their hormones and their pain and other symptoms. And when we sent out the email inviting you all to this, we certainly got a lot of questions submitted in advance. The advice today does need to be general in nature because obviously we're not going to know what all of your background history is, the results of your test, what other medications you're on and all of those kinds of things. So it's just simply not possible to answer specific questions about dosages or whether or not hormone replacement therapy is right for you and all of those kinds of questions. That's something you really do need to discuss with your regular healthcare team. And if you're having any trouble finding a healthcare team that is helpful to you, then please send us an email. We're happy to try and help you find the right advice for you. Most of our questions were related to life stages that are traditionally referred to as women's issues. And we just want to acknowledge that gender is a spectrum, that our trans and gender diverse individuals and men also experience hormonal changes, and we'll attempt to address some of those today as well. But the vast majority of the questions were around perimenopause, menopause and periods. So that is going to be the focus of today's webinar. Today, I'm joined by one of our lovely psychologists, Dr. Angela Simpson. Angela is a warm, nurturing, compassionate therapist who is committed to providing a safe space for her clients to grow and create meaningful change. She is skilled in cognitive behavioural therapy, acceptance commitment therapy, and mindfulness-based approaches. Alongside her clinical experience, Angela is a seasoned researcher who has published papers on a variety of topics from eating disorders, substance abuse to emotional regulation and impulse control. She has a special interest in women's health and in supporting all of her clients through whatever life transition they are experiencing. Thank you so much for joining us, Angela. As you know, we have a lot of questions and the main topic of today is hormones. So I'd invite you to, if you could please give us a bit of an overview of what sort of hormones are we talking about and what kind of effect can they have on our symptoms.
Thanks, Sonja, and it's so lovely to be with you today. I'm really pleased to be able to speak to this topic because it is such an important one, and one that I know as a health psychologist, this wasn't part of my training many years ago. We didn't learn a lot about menopause or how that impacts people, and so this is something that I've done, I've become quite motivated to learn more about, especially as I'm reaching this stage of life myself. It becomes a lot more important and front of mind. So I have a lot of content prepared. We'll see how we go. I do hope we can get all the questions addressed. So let's dive in. And just to reiterate Sonja's point that it is important to acknowledge that today's discussion on menopause, while we will be using the terms woman, women, female, it's important to acknowledge that menstruation and menopause are not experiences limited just to cisgender women. And so we do acknowledge that and are mindful and try to be as inclusive as we can. So let me dive into a little bit of a brief overview of the hormones and the relationship with pain. Please bear with me for one moment while I navigate my technology. So the endocrine system in our body is a network of glands and organs that produce, store and release hormones, which are the chemical messengers that regulate many of our bodily functions. They control various processes like metabolism, growth and development, mood, sexual function and reproduction. Today, with our topic being primarily on menstrual cycles and menopause, we'll be focusing mostly on the sex hormones, so the hormones that are produced by ovaries and also testes in men, briefly. So the important hormone that we will talk a lot about today is estrogen. And why estrogen is so important, particularly in the female body, is that it has an impact on every single bodily system that you can think of. So from your cardiovascular system to central nervous system, brain functioning, skeletal system, it is such an important hormone that women need for sort of functioning and thriving. We will talk about what happens in menopause shortly, but estrogen interacts with pain receptors in the central nervous system to modulate pain sensitivity. So it actually does help to turn down, manage pain. Higher levels of estrogen help with reducing pain sensitivity. Lower levels increase pain perception. So particularly for conditions involving inflammation or musculoskeletal health. So it has a really important role in modulating our experience of pain. The other hormone is progesterone that we sort of think about when we're talking about menopause. And progesterone has an anti-inflammatory property, or it has anti-inflammatory properties that can reduce pain sensitivity as well. So we're already talking about two hormones which are quite important for managing our experience of pain. Testosterone, which women do have in their body, modulates pain perception and has analgesic properties. So it can lessen the perception of pain, and it's also important for maintaining muscle mass and strength. So low levels can lead to fatigue, depression, and decreased motivation. The other hormone that we will be considering, although not focusing a lot specifically on, is cortisol, which is the stress hormone, which can also lead to increased sensitivity to pain when it's been released for very long periods of time and we're in a high state of stress for a long time. And endorphins are our natural pain-relieving hormones. So throughout our discussion today, it's important to know that we have all of these things in our chemistry that can turn up our pain, turn down our pain, and some of them we can harness to produce more, such as endorphins. So that's a bit of the landscape of the things that we'll be talking about today. Why I'm just showing you this diagram is that it shows a chart with three different events. So at the top, this chart is showing us the menstrual cycle, and it's giving us an idea of the purple sort of hill is showing us levels of estrogen and how these change over our menstrual cycle. And the pink is the progesterone. So this is how day one on the left of the chart is when we are menstruating. Our estrogen levels are quite low. They build up until they peak around the time of ovulation before slowly decreasing through the luteal phase, which is when, if we haven't had our egg fertilized when it's been released at ovulation, we are getting ready to then shed the lining of the uterus. This second half of this particular chart shows where we can experience hormonal changes that can impact how we're feeling in terms of we might experience premenstrual symptoms. So this is a group of physical, emotional, and behavioural symptoms that typically show up 1 to 2 weeks before we menstruate. And symptoms could include bloating, breast tenderness, headaches, joint or muscle pain, fatigue, and changes in appetite. I just want to note at this point also that there is the possibility that symptoms of fibromyalgia, given the decrease in estrogen, can also be exacerbated during this particular stage. The other two charts, I won't go into too much detail other than just to show during pregnancy, we can see that we have an increase in estrogen and progesterone up until the birth of the child, and then they quite significantly drop off. So again, the impact of estrogen and progesterone increasing like this is that we might actually be experiencing an improvement in symptoms and less pain of fibromyalgia and pain in general, given we have more of these hormones in the mix. This drop-off after the birth of the child is often where we might experience postpartum depression or other mental health issues could be exacerbated by this sudden decrease in estrogen and progesterone. And the chart at the bottom is just giving us a bit of an idea of over the lifespan of a woman, this is how our progesterone and estrogen typically show up. So during puberty, this is when we start to develop more of these hormones. They're released from our ovaries. They remain, again, this is general, this is not everyone's situation, and they can stay fairly regular until we reach perimenopause, where things start to take a bit of a dive. Just want to flag at this point too that while this seems like a smooth drop off, it's actually really quite jagged in terms of the hormones are up and down, up and down, up and down. So it's not a smooth decline in the terms of the reduction of estrogen and progesterone, but it's quite unpredictable and looks quite chaotic. I will just flag a couple of other conditions related to these hormones at the moment, just to flag that a small percentage of women, approximately maybe 5% of women of childbearing age, can experience premenstrual dysphoric disorder symptoms, which is a really significant condition that includes irritability, anger, feelings of sadness or despair, panic attacks. It's kind of like PMS turned up quite a lot, and it can be quite a debilitating condition for many women. And again, women with premenstrual dysphoric disorder symptoms may experience worsening of fibromyalgia symptoms during the luteal phase of their menstrual cycle. So there's that really strong link between the two. And I'm also just added this slide as there was a question about polycystic ovary syndrome just before we started. And I just want to flag this too, that this is a hormone imbalance that affects 1 in 10 women and involves increased levels of 2 hormones in the body, insulin and androgens, which are the male type hormones. The thing with polycystic ovary syndrome is that it can cause quite irregular periods and the onset, which can make it very difficult for conceiving, becoming pregnant. And they might have, one thing to flag also is that polycystic ovary syndrome might actually delay the onset of menopause, given irregular or infrequent menstrual cycles that come with this. So as you can see, I've listed some of the symptoms, including irregular or no periods, excess hair on the face or body, skin conditions, stress, anxiety and depression. I'm just flagging those because they are going to pop up a lot today, and they're certainly things that have a really strong link with our hormones. So a woman's mental health is quite significantly impacted by the hormones and what's happening in our bodies. I don't think I need to say too much more about this. I think I've already made the point about pregnancy. As you can see in the middle of this chart, shows that estrogen and progesterone at probably the highest level in a woman's life before significantly dropping off after the birth of a child. So this has really significant impact on women. Again, this change in significant, fast change in estrogen and progesterone can lead to a lot of mental health issues, but also exacerbate chronic pain conditions, including fibromyalgia. So And one more point that I will make before I turn off my screen and see your lovely faces again is just to mention that while we will be talking about menopause, it's important to note that men also experience a change in testosterone levels as they age, and this has been referred to as andropause. And starting from around middle age, so 40s to 50s, men can start to experience a gradual decline in testosterone levels. And this can exacerbate fibromyalgia symptoms and has a lot of symptoms that can have significant impacts on men's lives. So reduced libido, fatigue, mood changes, loss of muscle mass, and increased body fat. And it's important to know that testosterone can also be quite protective for pain. So the more testosterone you have, it can help turn down pain. So when you are losing your levels of testosterone, naturally your pain will be exacerbated. I'm going to stop sharing now. Sorry, I might have gone too long with that, Sonja. So get me back on track.
No, we're still running pretty much on time.
Good.
No worries. Thank you so much for that. It was really, really helpful to really understand what's going on with all of our hormones and things going on. As I mentioned at the start, and as we've discussed in preparation for this, we had a lot of questions around menopause and perimenopause. I simply won't have time to read them all out. We're really quite a lot, but I will read a couple of them out because they sort of encompass most of the various questions that were asked. And two in particular, I think will really resonate with a lot of people, and they're sort of the same. They're almost the same question, but from two exact opposite points of view. So some people suggest that my fibromyalgia diagnosis isn't real and it's just menopause. Could this be true? And on the other side of that, can a person be wrongfully diagnosed with fibromyalgia when it's really menopause? How do we tell the difference between menopause, perimenopause symptoms, and fibromyalgia symptoms? And does it matter? And how can we tell if we're in perimenopause? And are those symptoms different for a person with fibromyalgia versus someone without? And does it make any difference if it's a surgically or chemically induced menopause? But there's a big can of worms for you to address.
So many questions, and fantastic questions. So look, rather than diving in and out of my presentation, I'm just going to speak to this. And I think it's important for us to first define what we're talking about when we're talking about menopause, perimenopause. And I think this is also really important just from understanding the experience that the people with ovaries are going through when they reach menopause, because again, we don't get a lot of education about this necessarily unless we go looking for it. In my experience anyway. So if we talk about what perimenopause is, this is the stage of life where the ovaries gradually stop working. So this can start when someone is in their mid to late 40s, and it can last 4 to 5 years or more. It's very individual. There are so many different factors which impact when you start, what your symptoms will be like, and how long it will last. So menopause is actually then, it's a single day. So menopause is the day that marks 12 months after a woman's last menstrual period. So the average, so you've gone through 12 months and you haven't had a period, you have reached menopause. And the average age for this is 51. So about the age of 51, you might have achieved that milestone. This is, the typical range is between 45 to 55 years. So during this time, most women will reach this milestone. The day after that, you're now postmenopausal. So it's, for the rest of your life, you are now considered a postmenopausal person. And so early menopause is normally between the ages of 40, 45, and late menopause is sort of after that, 55 years. So there's our definition of what we're talking about. And it's also worth just flagging here that this is a time of life where a lot of people do start to get diagnosed with fibromyalgia. This sort of stage of life, it can be quite common. And so you can have those two things going on at the same time. So you're having perimenopausal symptoms and you're also experiencing fibromyalgia symptoms. So this is it can be very challenging and very frightening. You don't know what's really going on in your body, what's causing what. It can be really quite a lot. So just to flag that in perimenopause, what's happening is your estrogen levels have gone from regular and rhythmic with a nice cycle. Now they become chaotic. They're spiking and plummeting with an overall downward trajectory. So there's an unpredictable nature of what's going on with your hormones. Testosterone has a calming effect on the body and brain. So when we start again having this sort of ragged decline, this can lead to all sorts of problems, sleep problems, anxiety. So you're sort of starting to get this condition where everything's getting stirred up. Not only that, but we have testosterone, which is steadily declining. Women peak in their levels of testosterone in their 20s, and then it's just a gradual decline after that. So some of the impacts this could have is that this impacts your bone density, muscle mass, mood, energy, sex drive. So all of these things are starting to kind of get rattled around. And this is why at the menopause stage of life, women are starting to become at greater risk of osteoporosis, which is where our bones are quite brittle and they can break quite easily. And muscle mass, we can start lose conditioning, our body shape can change, a whole lot of stuff which can be really quite distressing and stir up a lot of thoughts about changing identity, change in how you see yourself. These are really quite significant. Go into the mix, we have melatonin, which is now decreasing. So this sleep hormone that normally helps sleep and regulates your circadian rhythm is also decreasing, and it starts to decrease from about the age of 40. So as you can see, it's kind of this perfect storm. You have hormones that are jumping ship, and they're kind of leaving you in a bit of a muddle as you try to figure out what to do and how to manage it. So the thing with the signs and symptoms, I'm going to pop this on the screen. Sorry, bear with my slow. Here we go. I'm going to be really good at it by the time we're done. So why I'm showing you this is just to put up an idea of what the symptoms and signs of menopause are. What you might be struck by is that there's a lot of overlap between what's showing up now in perimenopause and fibromyalgia. So there's brain fog. It's because this is being driven by hormonal changes, whereas fibro is not necessarily a hormonal fog. We can have word finding difficulty, harder to deal with stress, forgetfulness. One of the things that does happen and that is noticeable by a large proportion of women is this irregular menstrual cycles. So your cycle might be longer, the bleeding might be heavier. You can start to have these night sweats, which generally show up closer to menopause. So they might not be one of the first things you look for with menopause, but you can have the night sweats, hot flushes, and hot flushes generally can be very distressing for women. They're uncomfortable. They feel, they're not pleasant at all, which can lead to a lot of reactions to that in terms of how you view them, how you think about it. It can be quite distressing. And these night sweats and hot flushes are generally what can drive difficulty sleeping, whereas fibro difficulty with fatigue, it might not necessarily be hormonal issues that are making sleep difficult. So there's some subtle differences there. Muscle or joint pain is quite common in perimenopause. It's not necessarily as widespread or whole of body as fibro, and it might not last as long. So there can be a difference in the type of pain experienced. There can also be some unusual symptoms with perimenopause, like tingling fingers, burning mouth, burning sensation in your mouth, tiredness, trouble sleeping, urinary problems, dryness in the vagina, which can become really, really difficult to manage and uncomfortable. And then in the middle, we have our psychological symptoms. So anxiety and depression are really two big things that show up in perimenopause, and mental health issues are perhaps some of the most notable things that show up in perimenopause. So it's worth just flagging that, as you can see, there's a lot of overlap between fibro and menopause symptoms. And so the rest of the question, it can be hard to diagnose is the point. And why that is Why is it important to know the difference? I suppose that comes from a treatment perspective. So if you are noticing symptoms that are being driven by hormonal changes, then it might be that you speak to someone who is well informed, a healthcare provider who is well informed about menopause and can guide you in terms of different menopausal hormone therapy, which is now what hormone replacement therapy is now referred to as. So we have this new term I'm throwing in there, menopausal hormone therapy. So this is where we can look at strategies to basically replace some of that estrogen and progesterone that you're losing, because a woman's body really needs it to function. I'm diverting, Sonja, but just maybe give me 1 second.
No worries at all.
So in terms of the types of menopause hormone therapy that are available, there are different types. There's estrogen-only therapy, which is suitable for women who have had a hysterectomy, so don't have a uterus anymore. If you still have your uterus, a combined estrogen and progesterone therapy is generally what would be recommended. And it is possible to get estrogen-only local therapies, so creams like Ring, all sorts of different things for symptoms that affect your vagina. And why this is important is that another aspect of perimenopause is that women can start experiencing recurrent urinary tract infections due to all of the changes happening in their vagina and urinary system. So this is something which people are then commonly prescribed a lot of antibiotics for, but we might need to look at different ways of managing what's going on in your vagina. Why I'm kind of saying all this is that it's so important that you have a good relationship with a health provider who will take you seriously and will listen to your symptoms and help you unpack it, because it is such a scary time when you don't know what's going on. And a lot of doctors, GPs, might not actually be up to date with what the research shows about treatment for menopause. And I'm just thinking, I know of clients who have said to me, my GP won't give me menopause hormone therapy because of the stigma and risks that were talked about back in 2002. There was a study that kind of showed it was not helpful and was quite risky. However, that has since been debunked, and it is now considered the gold standard treatment for managing menopause. I say this as a psychologist. I'm not a medical doctor. I'm not giving that advice, but just to show that the landscape has changed and doctors haven't necessarily all caught up and are up to date with that. So if you are looking for a new doctor, there are ways, as Sonja said, we could help. But there's a fantastic resource in terms of the Australasian Menopause Society website, which we can share in an email, the name of that. And you can actually find doctors who consider themselves menopause experts that you can connect with. And we can share some more resources about how to connect with doctors who can help you during this time.
I will just quickly jump in there for a second, Angela, because we do have some international people who registered and have come to this. This is an Australasian one, so the actual doctors themselves on there may not be able to take you on as a patient if you are international outside of Australia, but the resources that are on that website are still worth having a look at.
Yep. Just to flag, thank you, Sonja. They also, that particular website also gives details for New Zealand, Canada, Singapore and Ireland.
Wonderful.
So maybe that might be helpful for some, but yet not everyone. Otherwise, the International Menopause Society might be another good touchstone for people. But yes, I'm sure there's ways.
Wonderful. So I guess that sort of comes down to really having to have a good chat with a good GP or specialist. So you mentioned the sort of things like hormone replacement therapy and that sort of thing menopausal hormone therapy. I've got to update the software in my brain. So we need to look at some other management techniques. And can you sort of have a bit of a chat about, there was one specific question that worded it really well, so I'll read that one out. What other non-hormonal management techniques are available to help you manage increased pain and other symptoms that come with hormonal changes?
Yeah, which is a fantastic question. And, if we think about hot flushes as one example of quite a distressing symptom. This impacts, 60 to 70% of menopausal women will experience hot flushes or hot flashes depending on where you are in the world. And these are, really prevalent following that rapid withdrawal of estrogen. And I think it's worth noting here that psychological treatments such as cognitive behaviour therapy have actually been recommended for the treatment of hot flushes. And you might be wondering why or how. How does that work? That's a great question. So CBT has a really important role in helping someone to, reduce anxiety and stress. So being able to perhaps look at what's going on in your life and find a way to turn down the anxiety and the worries can actually have a protective or a helpful function in reducing your pain and also managing these symptoms of hot flashes. So relaxation techniques can also be very helpful for turning down your pain and for managing hot flushes, and behavioural strategies. So things like really doing an assessment of your environment, making sure that the bedroom is comfortable, not too hot. You want to make sure that you avoid specific triggers. So that might mean not having spicy food, which might seem quite upsetting for some people, but making some modifications to diet, trying to get exercise, moving in a way that is okay for your body, but movement is actually going to help in managing these symptoms. Sleep can be such an issue. So working on sleep hygiene, looking at strategies for managing sleep. Again, these are things that a psychologist can help you with and support you with, but also education and feeling empowered to manage what you're going through is really important to be able to manage what's going on. So we're kind of looking at a whole body, whole person experience. It's about looking at lifestyle. Are there ways to, reduce stress on you? Is it about learning to say no to people and protecting your time a bit more? Regular exercise, I mentioned, a balanced diet, maybe an anti-inflammatory diet. I'm not a dietitian, but anything that's going to help reduce inflammation in your body will help with pain. And the other thing that I did want to touch on is things like mindfulness, meditation. Again, these are really helpful ways to manage not just menopause, persistent pain, and working on relaxation strategies like slowing down your breathing. Again, anything that's going to turn down your pain system to help calm things is going to be helpful for managing this stage. There's evidence for acupuncture and hypnosis for managing menopause symptoms. And one thing that people might be wondering about too are things like natural remedies. I referred to the Australasian Menopause Society website, and there is currently insufficient evidence to support the use of herbal therapies. So there's nothing that's been identified as, yes, you must rush out and do this. But a look through the literature shows that researchers, and again, there's a growing amount of research in this area of menopause, which is fantastic, but natural products have been used and investigated with sort of mixed but not overly convincing results, just from my view of the literature. So people find things like evening primrose oil has been found to have limited benefit for managing hot flushes. St. John's wort reduces the severity of depression. Again, there's some evidence, some studies have found it useful, but it's not overly compelling. Other things like wild yam cream, there's limited evidence. So if you went searching, there's a lot of stuff that has been tried, but there's no overwhelming support or recommendation that you use it. So what else have I got anything else to add to that? Maintaining a healthy weight is also really important. And again, it can be very challenging as we go through perimenopause and menopause. As I said, our body, we're gaining more visceral fat around our abdominals. Our body shape is changing, but as much as we can, maintaining a healthy weight and exercising and keeping moving our body will be so, so helpful.
Wonderful. It sounds like an awful lot of those recommendations are the same types of things that we recommend to manage our fibromyalgia. So I guess that's kind of good news for those of us who both have fibromyalgia and like you, I'm heading towards perimenopause as well. So I guess learning all of these tools and techniques is going to be really helpful. And that's really good news for people who are already subscribers. A lot of the things that Angela just mentioned, we do include some of those things in either in the content. They're not sort of specifically designed towards menopause or perimenopause or menstrual management, but the techniques are very similar. So we do have a chapter on sort of the basic overview of diet in the library. We've got a chapter on sleep. We do have quite a lot of meditation and mindfulness based techniques and those sorts of things. So if you do have fibromyalgia and you're heading into perimenopause, you probably will find a lot of relief with our program. The other thing that sort of I would like to invite you, Angela, to have a bit more of a talk about is the cognitive behavioural therapy that you just mentioned, and how that can help both fibromyalgia and menopause. Sorry, I've got you on a spot here without actually warning you I was going to say that.
No, that's okay. That's okay. That's my thing. So I'm happy to talk to that. But one thing I did just want to flag, and this was something I've made a mental note important to say, and I don't think I've said it already, but when we're talking about like mental health things that show up during perimenopause and menopause, the profile of what depression and anxiety can show up in menopause is slightly different to maybe what you might experience at other times of your life. And this might be just helpful from identifying symptoms and figuring out if you're perimenopausal or not. But the symptoms of depression that kind of show up, it's not so much the tearfulness with kind of depression, but it's much more the rage, the anger, the like irritability, and kind of the outbursts. If you're kind of noticing these sorts of shifts in yourself and it doesn't seem like you and it's out of character, that could be one sign that you are struggling to manage your mental health and what you're going through, which is absolutely understandable. And so when we talk about cognitive behavior therapy, what we are really focusing on is the connection between our thoughts, our feelings, and our behavior. So being able to start to tune into what are we actually thinking about our experience and what's going on with us, and how are we kind of responding to that? Because sometimes we can get into unhelpful patterns, and if we're starting to freak out a bit that we're maybe entering perimenopause and this is terrible, I can't stand it, what's happening to me, who am I anymore, it can be really helpful to sort of unpack those thoughts and even reframe them and look at them from a more helpful perspective, that this is the transition, it's challenging, but you can get through it. And supporting and building coping resources for that is really important. Again, just flagging that this time of life, particularly, perimenopause, menopause, if you happen to have children, you're most likely supporting them. Maybe they're going through puberty, so you've got a whole lot of hormones going on in the house, and that's hard. Or maybe you're a late starter and you have young children, and so you have the challenges of young children. Maybe you've also got elderly parents that you're caring for or supporting. So this is kind of the sandwich generation, which is a term that we kind of hear and a bit, and it's so stressful. So CBT is certainly well positioned to support you in managing that and managing this stage of life. Does that answer the question, Sonja?
Yeah, that's really, really helpful. We've run really well on time, actually, which we were both a little bit worried about, I think.
Yes.
I'd like to open it up. If anybody who's attended live, if you've got any questions that you'd like to ask, anything to do with fibromyalgia or how psychology can help, or with perimenopause or menopause, please, or any other hormonal problems that you might have, we'll do our best to answer them. But feel free to pop in if you've got a question or even something that you'd like to contribute. Doesn't look like we've got any takers. That's totally fine. Maybe I hope that means that everybody's questions were answered. Now, Dr. Angela has really kindly opened up some extra psychology spots in her calendar starting from next week. So if there is anybody who's online, unfortunately in Australia only, that's right, isn't it, Angela? Yeah.
Yeah.
If you'd like to see Angela to have a look and see how psychology can help you with your symptoms, then the link to her booking link will be in the email replay that we'll send out once the video is available. We do have some other psychologists as well. If you're in the US, we do have some US-based psychologists. So just reply to that email and let us know, and we'll be more than happy to connect you with a psychologist to help you with your symptoms. If you're interested in our program, if you're not already a subscriber, also reply to the email. One of the support coaches will be happy to give you a call and have a chat about whether or not our program's right for you. There's absolutely no obligation whatsoever to that phone call. We're always happy to talk about More Good Days. So if you've got questions, you're not quite sure if it's the right thing for you, we're happy to talk to you about it, and we can help you to get onto the right sort of plan. We can help you get in touch with a dietitian who knows about fibromyalgia. We can help you get in touch with a physiotherapist. We've got a lot of contacts to help you manage your symptoms and sort of get back to living a good quality of life. There is hope, and that sometimes feels like there isn't when you've got a chronic condition and you're also going through this stage of life and everything seems like it's a little bit too hard. There is hope and there is help. You don't have to do it alone. So thank you very much, Angela. That was really wonderful, really informative and so helpful. Thank you everyone who took the time to turn up live. That's really appreciated. It's always lovely to see people coming to these sessions live, and anyone who's taking the time to watch the replay as well. Thank you so much for taking the time to do so. It's something that taking that step towards looking after your health and getting yourself informed and educated is a really big step, and it's really important. So thank you very much.